Hi, my name is Alario. I'm a nursing student at MCPHS, and today I'm here with Limei, who I collaborated with.
Hi, my name is Limei. I'm the pharmacy student at MCPHS too. Today I will collaborate with Christine. We work together to present a patient case to you. At the beginning, we will overview the patient information. Then we will present the overall care plan from the nurse perspective and also pharmacy perspective. At the end of the video, we will talk about our collaboration. So Christine will start the case first.
All right. I'm going to start this video by giving you a general idea about our patient. She's a 26-year-old Caucasian female. She's in an accelerated nursing program and works part-time as a nurse assistant. Her chief complaint is that she has been gaining weight and has been very tired. She said that she's even gained over 30 pounds in the last 6 months and is wondering if it has to do with her hypothyroidism. I'm now going to discuss the patient's history of presenting illness. So the patient has had hypothyroidism for the past 3 years, but because her TSH level, her thyroid stimulating hormone level, was never too high, her doctors never placed her on medication. In October, this past October, when she went to her doctor complaining of being extremely tired and overweight, they decided to place her on medication. For past medical history, the patient has had major depressive disorder and affective seasonal disorder since she was 16 and was not treated until she was 24. She said at first she didn't realize she had depression and that it was hard to talk about. So finally, when she was 24, she went to the doctor because she did not want to get any worse. When she went to the doctor, she received treatment and she feels 100% better now. Additionally, in high school, she has had insomnia. So she's had insomnia since then. She's always had a hard time falling asleep. And now with her busy work schedule of having to go to school and go to work and get up early, it's really impacting her life because she often falls asleep at 2 a.m. She's tried melatonin in the past, but never really followed it completely. For past surgical history, the patient has had all 4 of her impacted wisdom teeth out when she was 17. She tolerated the procedure and has not had any other surgeries. The patient's family history includes heart disease, high blood pressure, stroke, pulmonary embolism, cancer, arthritis, obesity, Alzheimer's disease, and diverticulitis. However, what is pertinent to the patient's diagnosis is the history of diabetes, obesity, hyperthyroidism, and depression. The patient has never used tobacco or illicit drugs. The patient typically has 2 alcoholic drinks about every 2 months. She has never been a big drinker, and drinking alcohol has caused her to gain weight, so she does not like to do so. In terms of review of systems, the patient did not have any complaints other than what has been previously discussed. For the physical exam, the patient was appropriately dressed for the weather and occasion. She appears her stated age, her level of consciousness is oriented ×3, her color of her skin was pale pinkish and it was even throughout her body. Her mood was comfortable, cooperative, and she interacted pleasantly. In the purpose of saving time, I did not list all review of systems or physical exam because it is not necessary for this presentation to get a good understanding of this patient.
Go.
From the research from the book Nurse's Pocket Guide, I was able to prioritize 3 nursing diagnoses. In order, I would talk about fatigue, stress overload, and readiness for enhanced sleep. We did not talk about stress much in this video, but the patient expressed to me that she had been feeling overwhelmed lately because of school, work, her own personal illnesses, and a recent mom's diagnosis of cancer. So she said if I could help her with some stress tips, it would really help. Lastly, I want to say that I did not go in depth much about the nursing diagnosis because soon I will be handing in a written nursing care plan, so stay tuned. Now Limei is going to explain to you what she learned about our patient.
Allergy. Patient doesn't have any known allergy. The medication patient current on is citalopram 40 mg by mouth daily. Patient take it in the evening. Bupropion 150 mg once daily in the evening. Levothyroxine 25 microgram once daily in the morning. Ferrous sulfate 65 mg once daily. Vitamin D3 50,000 units twice a week. Metalonine 10 mg once daily. Patient also using Tylenol PM as needed for insomnia. The lab data patient provided is in October 2013. There is TSH 5.26 milliunit per liter. Vitamin D is 23 nanomole per liter. Ferritin is 22 nanogram per milliliter. Patient didn't provide diagnostic tests. Okay, based on patient chief complaint and medication list, I came out the following medication-related problem. The first is medication regimen not optimal. It's about levothyroxine. The dose may be too low. That may contribute to the patient extremely tiredness and weight gain during the last 6 months. The second is about citalopram and bupropion. The data showing they have a higher chance to causing insomnia and weight gain. So patient also taking it in the evening. So I suggest patient take it in the morning. And also patient may need additional therapy for her obesity. Her current BMI is 33.6. It's over 30. That's qualified for pharmacotherapy. So suggest patient to see her physician starting lifestyle change and also may start pharmacotherapy. I will provide soap notes for patient hypothyroidism. Subjective. Patient is a 26 years old white female with history of depression, insomnia, hypothyroidism, and anemia. During last 6 months, patient complained about extremely tiredness, weight gain about 30 pounds, difficulty falling to sleep. Assessment, objective. Next is objective. Patient lab data showing in October 2013 is TSH level is 5.26 milliunit per liter. T4 level is not provided, but it would be helpful if we have the data. Assessment. Patient's levothyroxine dose is low. This may contribute to patient's symptom of extremely tiredness and weight gain. Also, the extremely tiredness make patient had a late afternoon nap. That also may contribute to patient difficulty falling to sleep at night. The goal of this therapy is to make patient hypothyroidism under control and improve the overall energy and quality of life. The pharmacological plan is to increase the dose of levothyroxine. Monitoring parameter for efficacy is to resolution of symptoms such as extremely tiredness and weight gain. Also, TSH and T4 level should be within normal range. The monitor parameter for adverse events and also toxicity is levothyroxine can increase the risk for bone fracture, and also if the dose is too high can causing cardiac effects such as tachycardia. To follow up this patient, continue to check her TSH and T4 level every 6 weeks after dose changing until your thyroid is achieved. Once your thyroid is achieved, check her TSH and T4 level at 6 months and 12 months to make sure patient maintain normal thyroid function.
Okay. So for our collaboration, I looked through the eyes of the nurse while Limei looked through the eyes of a pharmacist. So we start by deciding who we should use as a patient. Then we interviewed the patient and prioritized what is really the patient telling us is their problem. So we talked on the phone multiple times and met multiple times to discuss how we could help this patient. After that, I really learned how important it is to look at patient's medication and the dose, because this can really affect a patient's outcome, and that was really all thanks to Limei.
Okay. During this collaboration, Christine really showed me how to look at a patient as an overall system and came out with a plan to take care of those problems. For me, as a pharmacy student, I just focus more on the medication list and then came out the medication related problem to find out a plan to take care of those problems. After this collaboration, I really feel the important thing I learned is let me realize how important to take care of the patient as a team by collaborating with other healthcare providers. So this is a very valuable experience to me, to both of us.
Absolutely.
Yeah, so that's the end of the video project. Thank you for watching the video.